Well, we're back from our fun and games in medical terminology one, and what we're going to talk about today in this video are depressions and processes. We've talked in our previous video in regards to the names of bones and stuff like that, but bones aren't the same. In other words, if I put one bone on the table, it's going to look dramatically different from another bone. And the reason why is each bone is configured differently. There's different processes or depressions that will be on that bone that make that bone somewhat special, and they're all there for a purpose. And we're going to discuss that very briefly today. So the first thing we have to mention about bone is there are really two types of bone. Okay, we may have talked about this very briefly before, but there are two types of bone that we need to think about. First, the first type of bone is what we call a compact bone. Now, if we look over here, you can see how the bone looks real hard and really dense at this portion, and this is called compact bone. It's also called cortical bone because the outer portion of the bone is called the cortex. Okay, called the cortex. Okay, and this cortical bone is very dense bone. It's very tightly packed material that make it very, very firm. Sometimes you'll see it cortical bone, sometimes you'll see it called dense bone, like you said before. Sometimes you'll see it called hard bone. Okay, if you looked at a soup bone, you looked at a soup bone, and around the outside, this area right here looks very hard, very firm, and that would be that area of that cortical, compact, dense type hard bone area. Again, what we usually find it in certain areas. This area right here is called the shaft. We talked about it briefly in our other video talking about this is the diaphysis. Okay, diaphysis, which is basically the shaft, and that has usually very thick cortical bone, okay, on the outside, which makes it pretty strong in this middle portion right there, which needs to be, because if you take a pencil and you hold it between your two fingers and bend it where it's going to break in the middle. So this area has to be resistant to that force by having a lot of dense bone in the middle. The second type of bone we have is called spongy bone. And spongy bone is a bone that basically we see up in this area up in here. And if you look, it sort of looks like a honeycomb sort of up in there. And spongy bone, it is lighter in weight. Okay, it's not as tightly packed. It's also called cancellous bone. Cancellous bone. It's also called trabecular bone because one of the words that we had before the vocabulary was trabeculi. And basically, what happens are small little struts. Okay, if I was to blow this picture up inside here, you'd actually see all these small little struts that are inside there that are aligned to different orientations all over the place, and that provides strength to the bone. It's sort of like a wall, has drywall, but behind the drywall are all kinds of studs that actually give that wall some type of form and some type of shape to provide some strength. Otherwise, the ceiling would come down. So basically, there's all these little struts in there, and all those struts have open spaces. So they have struts that will go in different directions to provide strength to the bone. Okay, and the gaps in between are larger gaps, and that'd be filled with the marrow area. The marrow either at the end of the bone, which is usually where in adults we have more of a red marrow, which are actually able to make blood cells, and then the rest of the bone usually we call yellow marrow, which is a little bit more fatty type of a marrow and not has the same ability to make blood cells. Okay, so this is called spongy bone, where we have these struts. And again, even though it's lighter and it's not as dense here, it's still very strong. It resists to crack. If I do see a femoral fracture, because of sometimes with osteoporosis, it's usually going to be in this area up in here because it is more cancellous bone. What happens is when people have osteoporosis, they actually start to lose these trabeculi. These trabeculi start to disappear. And that makes the bone weaker. But the orientation of these little struts or trabeculi is what provides considerable strength by decreasing the weight, okay, of a particular portions of the bones. Usually at the ends of the bones is where we're going to find this spongy or cancellous or trabecular bone. Sometimes they also call it medullary bone, because this area in here is called the medullary canal, and that medullary canal is filled with that medullary bone or that spongy bone, which is mostly yellow marrow in adults. Okay. Now, again, the major thing we want to talk about here are what are called surface markings. Okay, and the surface markings can be one of two types. Okay, two types of surface markings. One are called depressions or openings, and they're exactly what they sound like. Either they're a hole, a crack, a trough, or something that actually is hollowed out. And we'll talk about each of those. I'll give you some examples of each of those. So these are innies. Okay. We also have what are called processes. Processes are outies. Okay, and the outies are bumps, lumps, ridges, crests, hills, things like that are on the outside of a bone. Okay, and they could all have a specific name. And again, they're all there for a specific purpose. They're not just here, they're just like for ornamentation, but they're there because they do serve a purpose. Let's talk about those individual things. Let's first start with just talking about depressions and openings. Okay. Now, the reason why we have either a hole, a groove, sort of like a fissure or a crack or something like that. It allows a passage of soft tissue such as nerve, blood vessels, ligament, or tendon to either sit in a trough, sit in a groove, or to actually pass through it. Okay. There are a number of places where things will actually have to go through bone, and the only way they could go through bone is through some type of a hole or a crack or something like that. Okay. We also find these surface markings or these depressions could be at the formation of joints. In other words, if I looked at a joint, there might be some areas that are hollowed out that actually allow that joint to have a certain shape, which matches the shape of the bone on the opposite side. Okay. So those things will actually also be some depressions as well. Let's talk about those first of all. Let's talk first about a fissure. Okay. And a fissure is basically a narrow slit or like a crack between adjacent parts of bones through which the blood vessels, nerves, or something could pass. Okay. Particular example of this is what's called the superior, because we know what the word superior means. Orbital. Orbital means eye. We had that word before. Fissure. And if you look right here, there's a crack right there. There's a crack right there. There's one at the bottom. You can't really see it. It's going down. It's like a V. It'd be like a V-shaped area on both sides. And the one at the top would be called the superior orbital fissure, and the one at the bottom would be called the obviously inferior orbital fissure. And what that fissure is for, okay, is for allowing certain nerves to pass directly from the brain. If we look at the orbit, okay, which is the orbit, you know, is this area, which is that hole or that socket to fit the eyeball in. The eye actually has 6 muscles that move it. If you move your eyes in different directions, it has 6 muscles that do that. 6 muscles and 3 nerves, okay? 6 muscles, 3 nerves that actually move the eyeball. Well, how do the nerves get to the eyeball? That's a solid bony cavity. They go through this little fissure, okay? It's cranial, by the way, just for your information, it's cranial nerve 3, cranial nerve 4, and cranial nerve 6 that actually do that. And these three nerves go to these 6 muscles in a various array to be able to provide innervation to allow all the muscles to work of the eye to make the eye move in all different directions. So basically, going back, a fissure is a crack, and you actually see a crack right there. There are other places where we'll find cracks in bone, but that's probably a good one to look at. So that's called a fissure. A foramen. A foramen is a very large, or it doesn't have to be large, but sort of a hole, okay? It's a hole through which blood vessels, nerve, or ligament can pass, okay? There's one called the optic foramen. If I went back to the previous image that we had of the skull, you can't see it, but right just to the nasal side, towards the nose side, the medial side of that superior orbital fissure, there's going to be a little hole. And that's called the optic foramen. It's basically a hole that takes the second cranial nerve or the optic nerve from the brain directly to the eye, which is basically what records my vision. Okay. The one here that's probably I see, and this is called the foramen magnum, and that's this big hole down here. And that big hole allows the spinal cord to come out. The brain is going to be sitting inside the cranium, okay, and then what happens to the spinal cord, which is the continuation of the brain with all the nerves coming either into the brain or out from the brain, have to go through something, and they go through this large hole right in here. Okay, so this large hole is called the foramen magnum. Magnum means large, obviously. We also have a thing called the foramen, the obturator foramen, which we showed before. Remember we talked about the pubis from the pelvis come this way, and the ischium sitting down here. It created a hole in there, which is called the obturator foramen. So that's in the pelvis. But this foramen is an opening through which blood vessels, nerve, or ligament can pass. A fossa. Now, a fossa is a little bit different. A fossa isn't really a hole at this point, but a fossa is a shallow depression. Okay, it's a shallow depression. So what happens if you, now this right here, don't look at this right here yet. Now this bone right here, okay, we do it differently here. This bone right here is the humerus, okay. Now this part of the humerus right here is called the trochlea, and this little notch right here is the ulna. That little ulna, that notch fits around that trochlea. Trochlea means spool, okay. And it's sort of like a spool-shaped part of the distal portion of the humerus. We all know the humerus is the upper arm bone. What happens if you look right here, there's a little process that's right there, and that's called the coronoid process, okay? We haven't talked about processes yet because we're only talking about depressions. So if I straighten my arm out, okay, that process has no problem. But when I flex my arm, this little thing right here is going to fit and hit against the front of the humerus and would stop my arm from flexing or bending. Well, what we have is if we look right here, let me erase this so you'll be able to see it a little bit better, okay? Right where that red circle is, okay? If I'm going to draw it right in here, there's a depression. So when my arm flexes up, this little area of the coracoid or the coronoid process fits inside that little hole, or that little, it's not really a hole, but a little depression. It's a little trough that sits in there. And it's called the coronoid fossa of the humerus. This area back here is the olecranon. We talked about that as a vocabulary word. On the back side of the humerus, there's also what's called the olecranon fossa, so that if my elbow is bent, I can feel the olecranon, but if it straightens out, you can't feel it nearly much. Why? Because this part actually fits in a depression on the backside of the humerus called the olecranon fossa to accommodate this lump. Okay, so basically that's what a fossa is. It's a shallow depression. A sulcus. I love this one right here. A sulcus. A sulcus is a groove. Okay, it's some type of a groove along the surface that accommodates a blood vessel, nerve, or a tendon. Now, this again is the humerus. Okay, and this right here is the humeral head. It's the part that articulates or makes a joint with the scapula of the shoulder. Okay, and on the top and on the superior portion of the humerus, there's a bump right here. We'll talk about a little bit later. And there's a bump right here. And between the two bumps, there's a groove. Okay, and so right between the two, there's this groove that comes right through here. Okay, and that is called the intertubercular sulcus. Okay, tubercle is the name for that bump. Because it's between that, it's called the intertubercular sulcus. So it's a groove of the humerus. And what this is for, what this groove here is for, is the biceps muscle, which is the one that flexes the elbow and stuff. It also will actually abduct the shoulder, or bring the shoulder up that way just a little bit. It's not the major muscle that does that, but will actually bring the shoulder up that way. What happens is the biceps is called the biceps because bi means, as you know, bi means two, ceps means head. Okay? And what happens, the biceps has two heads. So what happens is the muscle comes like this. When it gets up close to the shoulder, it divides. There's one head that goes this way, that goes to a little process on the scapula called the coracoid process. Another head that comes this way. This is called the long head that comes up this way. Well, there's a tendon. This is a tendon right here, and the tendon runs in that groove. And what we find is that over the top, from this tubercle over here, there's a ligament comes across, it connects that two, and the tendon then runs underneath that ligament to provide like a little tunnel. So that because it's depressed out, if we were looking from this way up, okay, you'd actually see when you looked at the humerus at that point, you see a tubercle here, you'd see a depression in the middle, you see a larger tubercle right there, and that would be that little groove that we'd see. So we're seeing it, looking it up in this direction. So a sulcus is a groove along a surface that accommodates a blood vessel, nerve, or tendon. In this case, it accommodates that tendon in the area of the humerus. Meatus. Now we're talking about another depression, which is more like a hole. And a meatus is almost like a foramen, but instead of being a foramen, it's more tube-like. Okay, now this is a skull right here, and this area right here is called the external auditory meatus of the temporal bone. This bone right here is called the temporal bone. Okay, and this area right here is the hole that's your ear canal. If you go into that hole, they're sticking a needle in there, a little pin in there. in a person, you'd go in a little bit, and what happens is the eardrum would be inside that little tunnel. Okay, so if you take your finger, stick it in your ear, you're sticking it through that area of the external auditory meatus of the temporal bone. Okay, as far as it'll go, it can't go very far. But a meatus is like a foramen, but it's more of a passageway. It's more like a tunnel, more like a tube. So that's what this meatus is. That's a difference, okay? And again, this is the external meatus, external auditory meatus. Auditory means hearing, okay? That's another med-term word that you could think about. Now let's talk about some processes. Now processes are different as compared to depressions because what they are is they're projections or outgrowths of bone, okay, that form a joint, form an area where things could connect to, or whatever the case may be. So there could be attachment points for connective tissue such as ligament, tendon, and tendon connects. Again, ligament connects bone to bone, tendon connects muscle to bone. That's always a good thing to remember. Tendon connects muscle to bone, ligament connects bone to bone. So if I want to connect something, I have to have a place, a hill to be able to connect to in many cases, and that's what we see with these processes. Okay, so we'll see this. Now, the first process we have here is called a head. You know why they call it a head? Because it looks like a head. That's the head. It's the rounded articular portion of a bone. It's actually, and then what happens, it sits on a narrowed portion right here. And guess what they call that? They call that the neck. So we have the head right here that sits on top of the neck. Okay. Example, this is the femoral head. It's rounded. We have one at the humerus or the upper arm bone, which is a humeral head that fits inside that little socket, a very shallow socket on the scapula. Okay, so the head is the rounded portion at the end of the bone, just like a person's head would be. Okay, and usually sits on an area called the neck. The neck would be this area in here. Okay, so that's what's called a head. A trochanter. Okay, now a trochanter is a very large projection on a bone. Now this is the femur again, over here. Femur again. Again, here's the head. Here's the neck. Okay, and then there's a large area right here, a large lump right there. And that lump right there is called the greater trochanter, the greater trochanter of the femur. There's a smaller one right here, and guess what they call that? They call that the lesser trochanter of the femur. So these are large bumps, and basically they're for attachment of muscle. The muscles that rotate the hip in and out, okay, your thigh in and outwards, will be attaching to this area and to this area right there. That's primarily what attaches to that. And it's called a trochanter. So a trochanter is a very large outward projection off of a bone. A tubercle. Tubercle is sort of like a trochanter wannabe, okay? It's smaller. It's a smaller rounded projection, okay, as compared to that large projection we saw with the trochanter. So a tubercle is another projection out of the bone, but smaller, okay? Now, if hard to see here because these are very difficult to see because they're much smaller. Typical example of one would be this thing right here, which is called the tibial tubercle. Right here. If you feel your knee, you feel your patella, your kneecap, and you feel the tendon that's going to go down from the kneecap, from the patella, down to the tibia, which is the larger of the two shin bones, as we know, on the medial side, which you should know. When you feel that tendon come down, it's going to attach to a bump. And that bump is going to be a little area right here, and that's called the tibial tubercle. The tibial tubercle, and basically it's a smaller projection. It's not quite as large as we'd see with the trochanter, but it's palpable. And we talked about this other one over here, the greater tubercle of the humerus, is when we talked about that sulcus. We saw a bump, then we saw another larger bump, and then this one would be the greater tubercle of the humerus. This one over here would be called the lesser, and that would be that sulcus between the two, the intertubercular sulcus that we talked about in an earlier slide. Okay, so a tubercle is a smaller rounded projection on a bone. It's usually for attachment of a ligament or a tendon, in this case a tendon. Okay. In the case of this humerus, it would be a ligament. Okay. Tuberosity. A tuberosity is a large rounded, usually more roughened projection. Now, we talked about this before, and this gets when we talked to the vocabulary terms. This area right here is the pubis, okay, and this area down here is the ischium, okay, and then at the bottom of the ischium right here, this is that acetabulum, that hip socket, where that head of the femur is going to fit right inside here. So this is the ischium. Right down here at the bottom of the ischium, it's sort of like a projected area. It's very rough. There's a lot of little holes in it, little bumps and holes, okay? And that area is called the ischial tuberosity. And actually the hamstring muscles, which are basically the muscles on the back of the thigh, they attach here. There's actually 3 hamstring muscles. They attach back in here. So they attach this area because it's roughened, allows for an area to attach pretty well. If you're sitting on like a hard bench, like at a football game or something like that, how sometimes you have to keep on rotating your butt around because it gets a little sore. What happens, you're sitting on this area right here through the gluteal muscles, and that's what sometimes causes, actually not so much gluteal muscles, more hamstrings you're actually sitting on, but basically you're sitting on that, so you rotate it around to take a little pressure off there for a while. So a tuberosity is a large, rounded, usually more roughened projection on a bone, and that's a typical example of the ischial tuberosity. A condyle. Now, this is something we've probably talked about a little bit before, and we've mentioned. If I was to ask you to draw a picture of a bone or draw a diagram, I'm sure you'd probably draw something like this. I'm probably right about that. I'm not right about everything, but probably right about that. These little rounded areas at the end are called condyles. If we look down here, here's a condyle. Let me use a different color here. Let's do it this way. Here's a condyle. Here's a condyle. Here's the back. This is posterior. There's a condyle. You can see the condyle from the side. You see the condyle from the side. And basically, these are the medial or lateral femoral condyles. Okay, and these are areas that they actually provide that area right here that's going to provide a nice surface to articulate or to join with another bone down below. Okay, it's going to be a complementary or just the opposite form. Okay, so condyles are large, When we look at a condyle is a large round protuberance at the end of the bone. Okay, and again, medial and lateral femoral condyles are what we show in this particular image here. A facet. Now this is a little bit more difficult to understand. It's harder to see, okay? But what happens is a facet is a smooth, flat articular surface, okay? And when we look at this bone right here, this is a vertebrae, okay? This is a vertebrae. This is the body of the vertebrae. This is where one vertebrae is stacked on top of the other. And this area right here is the vertebral foramen, or the spinal canal, where the spinal cord is going to fit right inside this hole right here. But what happens is we do have one vertebrae connected to the other vertebrae by a disc that sits from one body of one vertebrae to the next, and they sort of holds it together. But we allow another couple places for articulation. And again, articulation means a joint. And right here, there's a joint, and right here is a joint. And these joints are relatively flat, okay? And there's one on the bottom side, just below this. On the other side of the bone, there's going to be one just underneath here as well on both sides. And these are called facets, and these are vertebral facet. So when I look at vertebral facet, that's what you see. And if I'm looking at a vertebral facet, the joint is relatively flat. So that'd be one joint right here is relatively flat. And the bone on top of it would have a complementary flat surface. So this one right here would be articulating with the vertebrae above. The one on the bottom would be articulating with the vertebrae below. Okay, and these flat surfaces allow them to move in this direction. Okay, or this direction, okay, and now allow a rotation. So in other words, if you take your two hands and put them together this way, they could move this way, they could move this way, okay, they could rotate on each other. And that's what's allowed. That's why your back gets a little bit of motion, because of these rotational motions and sliding motions that will occur at these facets. But remember that a facet is a smooth, flat, articular surface, which is different from what we've seen before, like a condyle. Condyle is a very round surface. A facet's a very flat surface. A crest, okay? A crest is pretty easy. So like, let's go over the crest of this hill, okay? And basically that's easy. A crest is a prominent ridge or elongated projection. And basically this is what's called the iliac crest. The iliac crest from here to here, okay? And basically if you feel on your sides, just above your area of the hips, you'll feel this large crest of bone. And that's called the iliac crest. Okay, that's right there. So that's a large projection of bone, very easy to see. This would be muscle will be attaching in here, muscle will be attaching the outside. But this, and there's actually muscles that will attach to the crest as well. Then allow my trunk to rotate around, my abdomen and trunk to rotate around. Another crest that you can easily see, if you actually want to feel it right now, is the anterior tibial crest. If you feel the front of your shin, you'll feel a very sharp edge of bone right down the front of the shin, and that's the tibia. That's the front edge of the tibia, the anterior edge of the tibia, and that's called the anterior tibial crest. So it's actually quite prominent as well. So that's the anterior tibial crest. Okay, so a crest is a prominent ridge or elongated projection on a bone. Epicondyle. Epi, we know, if you've, again, you should know all these prefixes, means upon. Means upon. Upon what? Upon the condyle. So if this area down here is the condyle, the area on top of it, on top of it, on top of it, on top of it, on top of it here, on top of it here, would be called the epicondyle. So so an epicondyle is a projection above a condyle. And again, medial femoral epicondyle would be the same thing. This is over here is the medial femoral epicondyle, right in this region right here. Okay, medial femoral epicondyle. A line. Okay, a line. I mentioned that there's sort of like a tuberosity is sort of like a trochanter wannabe. A line is sort of like a crest wannabe, okay? And a line is a long, narrow ridge or a border of something. Now, this is the femur sideways, okay? So it should be upright, but as you see it better because I can make a larger picture going sideways. So this up here, again, is that femoral head, okay? We saw that before. Here's the femoral head sitting up here. Here's the neck sitting right here. Here's the greater trochanter, okay? The greater trochanter. Here's the lesser trochanter. And what happens is this is called the intertrochanteric crest. There's a crest back in here. But below that, there's this line that comes straight down here. You can actually see it right here. You can see it right here. You can see it. Let me get rid of a little bit of that so you can actually see it better now. So there's a line, okay? So if I look at here, it's a mini crest, okay? And about here, it starts to divide. Part of it goes this way, part of it goes this way. And this area right here is called the linea aspera. The linea aspera, okay? It's on the posterior side of the femur, okay? And what it is, on the back, I mentioned before, there are hamstrings, and the hamstrings are the muscles in the back. They pull your leg back and they help to flex your knee or bend your knee. Okay, and what happens is there are two medial hamstrings and there's one lateral hamstring, and they divide those because there's an area of fascia or connective tissue that actually comes and attaches to this line that actually divides. So you stay on that side of the fence. I'm on the you two guys stay on that side of the fence, and that's what that is. And what happens is it separates here because part of the hamstrings go laterally over the lateral on this side and the medial the opposite side. Medial hamstrings would be 2, lateral hamstrings would be 1. Okay, so that's that. Also, while this up here we talked about was the intertrochanteric crest, on the anterior side, and this view down here is anterior, or this is posterior up here. Okay, what happens is here's that lesser lesser trochanter, greater trochanter. There's a smaller area here that connects the two, and that's called the intertrochanteric line. Intertrochanteric line. Okay, so a line is sort of like a smaller version of a crest. A spinous process. Now we're going back to the spine here, okay? And a spinous process is a sharp, slender projection, okay? And this is spinous process of the vertebrae. And we can actually see this quite well right here. And this is a transverse process right there. That's a spinous process there. But this one back here is the one you feel. If you feel your back, or if you look at somebody's back, you'll see these little bumps up the back. And that's what you're feeling right there. You're feeling the spinous process that extends posteriorly. Again, this would be anterior, this back here would be posterior, and that's extending posteriorly backwards from the vertebrae, because we know this is a vertebrae like we talked about before. And that's called a spinous process. So what we've talked about in this a relatively short video is about the different lumps and bumps on the bone. Now these are important, okay? If you're going into certain type of radiography or something like that, these will be very evident when you look at radiographs. When you look at X-rays, these will be very easy to see, okay? So it's important to understand these little processes as well as depressions that we find in bone, because they help to identify the different types of bone. They help to make sure realize that they're there for a purpose. They're not just there because we want to hang some bling on there. Okay, this isn't bone bling or anything like that, but something that's there for a purpose. Either something goes through it, something attaches there, makes a nice configuration to meet with another bone in a particular joint. All these things are very important when we come down to these processes and depressions. Okay, and we'll get back to you a little bit later. We'll talk another video in regards to the various parts of the bone, some of which we've already discussed before in our vocabulary terms. Okay, so for now, be safe, and we'll talk to you later with another video. Okay.